Namaste. I am Dr. Dinesh Gupta, DHMS, and I will be teaching homeopathy. I am not using the word that I will be teaching about homeopathy. The word about means going round and round. So, what is homeopathy? Homeopathy is a therapeutic art and science. It is a medical science. The intention of taking these lectures, I am taking all these lectures because there is a difference between a person who has taken a degree in homeopathy, who has studied 5.5 years homeopathy, and a person who has read books and he is practicing homeopathy. I always tell, homeopathy is a medical science. So, a person who has taken degrees in homeopathy, BHMS, MD people, those people should act and behave like doctors. They should know to diagnose cases. They should not talk nonsense. So, my intention is to make homeopathic physicians. I consider homeopathy at par with the main line of treatment. So I want to make homeopathic doctors, homeopathic physicians who should have knowledge of medicine as well as homeopathy. Homeopathic people, doctors, the teaching and learning of homeopathy is so much pathetic that they don't consider themselves only doctors, because talking nonsense doesn't create doctors out of you. You should know what you are talking. So, to study homeopathy, to become a homeopathic physician, what are the requirements? Hanemann says, who can become a homeopathic physician? He says this thing in Aphorism number 3. The first two aphorism you forget for now. The physician's high and only mission is to restore the sick to health, to cure as it is termed. Nowadays, the mission has become to what? Just go on babbling. Just go on showing off. That has become the mission of the physicians. The second thing, the highest idol of cure. See, Hanemann is first working. He is first practicing, and from his observations, he is writing. There has been 6 editions of the Organon, and it has taken 48 years of Hanemann's life to write the Organon. I have been teaching in medical colleges, and I have been teaching many a times. I have taught these things. It is my observation that very few people have read the Organon, and out of that few people who have read the Organon, very few of them know to apply the Organon. A man working for 48 years of his life has written these things, Each and every word, the placement of each and every word is important in the Organon. Organon has to be practiced. You cannot know the Organon just by what? Reading it. Though many of them haven't read it also. So, to become a homeopathic physician, to become a very good homeopathic doctor, when I say homeopathic doctor, I mean to say handling real cases. I will take those things. Why does everybody thinks that he has become a very great homeopath? I will come to those points. But first, you should know what is the requirement to become a homeopathic physician. And this requirement Hanemann gives in Aphorism number 3. In Aphorism number 3, Hanemann says, the requisite, the things required to become a homeopathic physician is first of all what? Knowledge of disease. Knowledge of disease. Do people have knowledge of the disease? I have classified the diseases. Before starting to practice, you should know what is the classification of disease according to Dr. Hanemann. The second requirement is what? Knowledge of Materia Medica. Knowledge of Materia Medica, MM. The second requirement is what? You should be thorough with your Materia Medica. If you only know to repertorize the case, you cannot become a homeopathic doctor. Remember that. You have to read the Materia Medica. Whatever I am speaking, each and every line of the Organon, I am going to demonstrate on patients, on live cases. Then you will understand the genius of this person, what he has done. I mean, taking homeopathy casually, taking homeopathy lightly, that is not homeopathy. And that is why homeopathy is not recognized through the world. Because maximum of them think what? That homeopathy is a science which is an alternative. If nothing is happening, we can go on giving homeopathic medicines. Homeopathic doctors, they don't take responsibilities. You know, people die in the hands of everybody. I mean, when there is a patient, there are chances that the patient dies. If he is suffering, if the disease is so much severe. But homeopathic doctors don't manage those cases. They don't want to take responsibility. When a patient dies in the hands of allopathic doctor, you know, the doctor apologizes. Sorry, I couldn't save the patient. But homeopathic people, they don't take the responsibility. If suppose a person is terminal, nobody is looking at him and you are just going there and just you are going casually over there. If he dies, he dies. Suppose you are taking a case, you are handling a case of chronic renal failure and the patient dies. You never tell the patient, I am sorry, I couldn't save the patient. No. What people do? He was on allopathic medicine, so he died. No responsibility. So, knowledge of disease is the first criteria. Second is what? Knowledge of Materia Medica. And third is what? The knowledge of Organon. Applying the principles. Knowledge of Organon. Applying the principles. You cannot apply the Materia Medica in disease condition unless you know the principle. People say they cannot remember the Materia Medica. They don't read the Materia Medica. They cannot memorize the Materia Medica. It simply means what? You don't know the philosophy of homeopathy. That is why you cannot remember the Materia Medica. The day you know the philosophy of homeopathy, that day, you know, you will remember the Materia Medica. So these are the three things. Materia Medica nowadays has become mental masturbation. MM for Materia Medica and MM for what? Mental masturbation. Masturbation doesn't mean only sexual, in the sexual context. The word masturbation means what? Deriving pleasure alone. Homeopathic doctors, they are coming out with Materia Medica. They are changing the Materia Medica. Every 5 or 10 years, a new moron will write a new book on Materia Medica, and the younger generations are reading those things. Those things cannot be at par with the books written by Dr. Kent, Nash, Allens. Every moron, he is not a doctor, he hasn't taken any serious case in his lifetime, and he is writing what? The Materia Medica. It is Materia Medica pura. It cannot be changed. I handle very, very serious cases right from the beginning. It may be what? Acute case or cases like cancer, terminal cases of cancer. And I am proud to say that I have given result in life-threatening cases also with homeopathy. I have handled and given result, saved people's lives. But I haven't gone, I don't understand, how people can practice homeopathy with the specifics. There are some remedies, 70 remedies proved by and written by Dr. Hanemann. Very negligible cases I might have gone out of those 70 remedies. And people who don't understand homeopathy, what they say? Oh, our Materia Medica remains the same, there should be new additions. All stupidity. There cannot be a new addition in our Materia Medica. The Materia Medica written by those people some 200 years ago, they have verified the symptoms. All the remedies which new people are bringing up, you cannot rely on that remedies because the proving is not done properly. People are changing rubrics. Any person, he will say, this thing I have found, and they change the rubric. That is not homeopathy. Homeopathy is a very, very difficult science. It should not be taken casually. You can do miracles with homeopathy. But you can do these things when you study hard. When you know the philosophy. So these requirements, ask yourself, do you know the disease? Do you know the classification of disease? When a patient is coming to you, can you classify? You see the classification. In the next lecture I have taken in detail about what? Knowledge of disease. Do you know your Materia Medica? Do you know the philosophy of Organon? These are the three basic criteria to know, to practice homeopathy. Homeopathy for severe diseases. Handling diseases like acute myeloid leukemia. Handling diseases like what? A person is having dyspnea. Severe dyspnea, 5 times a day. Handling those cases. I am going to show you cases. Very, very severe cases. Patient becoming what? Unconscious at the time of corona. Handling those cases. That is homeopathy. Curing cases of 3rd and 4th stage of cancer. That is homeopathy. Farting. People what? Fart and they take homeopathic remedies. And they say what? They have cured. Farting is what? A normal physiological process. So this is the jokes of homeopathy. I have seen people who have read books. They go on taking. If they fart, they will take Lycopodium of China. Gas ho gaya hai. They say gas is there. This is what? This is homeopathy. This is nonsense. They say, they write, the Queen takes homeopathy, or if celebrity is taking homeopathy. Just see what they are taking homeopathy for. Gases, jet lag, pain in the body. Name a celebrity who has taken homeopathic remedies. Name any one celebrity who has taken homeopathic treatment for diseases like cancer or something very serious in the body. The things which they write, about homeopathy, those things, it will go. If you travel and if your body aches and you take rust drops, that is not homeopathy. Those things go away on its own. So, these are the things. No responsibility if it goes away. People who read books on homeopathy, patient is coming to them, whatever is happening to the patient. First of all, the patients which they see, they don't require any patients. Maximum of the people don't have any diseases only. They go for what? Time pass. And especially people who are practicing homeopathy, if they really fall sick, suppose they are having a fever or something, which is troubling them very much, then homeopathy will not work. Then they will run to what? The MDs. Then they cannot manage themselves. Why? Is it applicable to other people only? Why can't you manage serious things when it happens to you with homeopathy? So, in aphorism number 3, Hanemann is saying what? You should have knowledge of disease, you should have knowledge of Materia Medica, and you should have knowledge of what? Organon. I will be teaching the Materia Medica on patients. Everything, every remedy, everything will be taught on what? Patients. I will be teaching the Organon, each and every aphorism, each and every line, demonstrating it on what? Patients. Homeopathy is a medical science. It is not a science of what? Hypothesis. It is not a science which is taught theoretical. They are teaching case taking. Case taking theoretically. When you teach case taking theoretically, then you ask stupid question to the patient, how many times do you urinate? How many times do you go to shit? It is because homeopathy has been taught what? Theoretically. That is why you ask the patient how many times do you drink water? How many liters of water do you drink? These are what? Stupid things taught to you. This is not the way to take homeopathic case. If you are doing these things, know that you don't know anything about homeopathy. Neither do you know anything about disease. So how to take the case? I will be giving what? Live cases. And then you see how much you know. It is going to make you doctors. It will build up your confidence in homeopathy. So, if you have got knowledge of these 3 things, along with these things, Hanemann says, you should know about what? The proper dose. The proper dose. How much should be given? That is the potencies. Along with this, you should also know what are the obstacles. What are the obstacles that a person who is having the disease, generally most of the times the person himself has created those diseases. I will give you an example. Suppose a person is alcoholic and he has damaged his liver. So unless and until this person stops taking alcohol, no medicine, any type, homeopathy, allopathy or whatever medicine he is taking, he cannot be cured. So a physician should know what are the obstacles that is preventing cure. If you know these things, then with homeopathy you can manage any type of case. People hospitalized, you can manage those cases also. But you should have knowledge. Generally, what are the cases you are taking? Those people they will be well off. without medicines. And you will come to know, when I will take the cases, you will come to know, I will be taking a lecture on indisposition where no medicine is required. So many cases, I will show you cases which appear to be very severe, but I have cured those cases without any medicine. So the charm of homeopathy is where in the real dynamic diseases, where something is at stake, you have to take responsibility. People don't take responsibility for their own children. When their children have 102 fever, they will run to a pediatrician. I am talking about what? Homeopathic physicians. Why don't you have so much confidence to manage your own child or your own self? A person who has studied BHMS, he cannot manage his own self for what? Viral fevers. Simple viral fevers. Forget about the pneumonia and whatnot. They are the first to run to allopathic medicine. Why? Because you don't have confidence. I have seen people practicing for 20 years, 30 years, then also they don't have confidence to manage themselves and their family members. Why? Because you know you are not confident, because you know that you don't have the proper knowledge of the disease or the Materia Medica or the Organon. That is why you do these things. So, this is the aphorism number 3. I have taken, as I told you, I will be teaching about all those things. Everything will be covered. So this is aphorism number 3. Whatever aphorisms are there required. The second aphorisms I will show you. What is the highest ideal of cure? How many doctors do get reversal, or how many doctors have seen the highest ideal of cure in their practice? Just reading it doesn't make any sense. So I am going to show you the highest ideal of cure should be rapid, gentle and permanent. So those things it cannot be taught theoretically. Hanemann has written it in the second aphorisms, but every time Hanemann has updated his Organon, a new thing has come up. It was not like that the first only he wrote the second aphorism. No. Later on, 4th, 5th aphorisms he came. If you see the first edition, these things are not there. Every time he is changing. He is working. He is experiencing everything on the patients. And he is repeating his experiences. He is confirming the things again and again and again. And then he is writing these things. Ask yourself, how many people have read the Organon? How many people have applied the Organon? Ask yourself, and then you talk about what? The highest ideal of cure. How can you talk about a thing which you haven't seen? So, my intention is to make what? Homeopathic doctors. I will be teaching medicine. Along with this, you should know the diagnosis also, how to diagnose the cases. So, that is about what? Aphorism number 3. This is just what? The aphorism I have written. Hanemann says, if the physician perceives, the word perceive means what? To see with understanding. And how can you understand things without not seeing it? First, if you are doing the classification of disease, I will show you which disease comes in what category. So that is the meaning. You first see and then you learn the Organon, then you teach the Organon. I haven't understood why people teach the Organon when they themselves don't know. People writing books on Organon. I would like to ask them, can they demonstrate the killer aggravation on patients? Can they demonstrate the prolonged aggravation in patients? If you haven't seen these things in your lifetime, please don't write the Organon. Any person who is writing the Organon should have the dignity to debate. Homeopathic doctors, they don't have dignity to debate. They will not debate also. They will argue. Argue at a personal level. They will abuse each other. And both of them don't know what they are doing. So, homeopathic doctors should first, stop acting too smart. And stop arguing. And have a debate with dignity. Have respect. When you are arguing, when you are having the debate, show me on patience. Whatever you are speaking, show me on patience. If you are saying that homeopathic cures meningitis, show me a case of meningitis where you have cured. People talk such nonsense things. A child is having headache and they say they have cured meningitis. If the T3, T4 level has increased or it is more than normal, the morons say they are treating what? Graves' disease. Have you seen a Graves' disease in your entire life? People teaching febrile convulsions. These are the remedies for what? Febrile convulsions. Show me a case where you have managed the febrile convulsions. So don't go on lying. Don't go when you cannot manage a case of simple fever in your child. Forget about managing what? Febrile convulsions. What you can do, the child is coming from school, he is complaining what? He is not having problem, the child is not having problem. Children, they play, he is having pain in the foot. Okay, give Rustox. Give this. The child is not having problem. You can only do that things. When the child really has problem, when he is having fever, then what happens? Then you will not give. Another thing I have seen, homeopathic doctors, what they do, when the child, they have taken the child to the pediatrician and after returning, when the child has become well in 2 or 3 days, then they will start giving homeopathic remedies. And then they will say they have cured. A person boasting about, I read in an article, a lady was saying, I told the pediatrician to do this and to do that, to do this thing and that thing. And boasting about homeopathy. If you are so much confident about homeopathy, why did you go to the pediatrician? As simple as that. So every problem in homeopathy will be solved. If what happens, whatever you are speaking, just show me its practical application. Whatever I don't mind polypharmacy. I don't mind anything, whatever there is in the market. But I want to see it, how you get results by using the polypharmacy. In what cases you are getting result. Homeopathic doctors they don't know only what they are curing. They cannot diagnose the condition. So, you should know to diagnose. You should know what you are curing, what you are dealing with. You should be thorough in your medicine. Then homeopathic will advance. There is no other way. At least learn homeopathy, not to show anybody. At least learn homeopathy for yourself. In your lifetime, you will be satisfied if you can manage and save a life with homeopathic remedies, with the art of homeopathy. Serious cases, one case of cancer you cure and you will be satisfied throughout your life. So, that's all about aphorism number 3. The next thing will be what? Knowledge of disease. As I told you, everything I will be showing on what? Patience. Thank you. Namaste.